Hello, I'm Dr. Maria, and I want to talk with you today about something that affects so many people over 60, yet rarely gets the attention it truly deserves. If your ankles swell so severely that you can barely bend your foot by the end of the day, if your legs feel heavy like stones, or if your socks leave deep indentations in your skin that last for minutes, then this video is specifically for you. Today, I'm going to share a detailed summary of important research and clinical insights about severe leg swelling, what we call edema, and more importantly, a complete nighttime protocol that can help address this issue from multiple angles. This isn't just about comfort. This is about your vascular health and long-term well-being. Please stay with me through this entire video because what I'm about to share represents years of accumulated knowledge. And the seventh step I'll discuss is something that many specialists use but rarely talk about publicly. This could be exactly what you've been searching for. Let me start by explaining what's really happening when your ankles swell severely. This isn't just minor puffiness after a long day. When fluid pools stubbornly in your lower legs and refuses to move, it's telling you something important about your circulatory system. Your vascular system is working hard to pump blood back up from your feet to your heart, fighting against gravity every single moment. When that system struggles, fluid begins to accumulate in the tissues of your lower legs. This creates what we call venous stasis, which means the blood flow has slowed down significantly. This matters because sluggish circulation in your legs creates an environment where serious complications can potentially develop. I'm not trying to frighten you, but you should understand that persistent, severe swelling is more than just an inconvenience. It's a signal that your body is giving you, asking for help. You've probably tried the standard recommendations: elevating your legs when you rest, soaking your feet in warm water, reducing salt in your diet. And yet, despite following this advice faithfully, the swelling continues night after night. Here's why those approaches often fall short. They're addressing the visible symptom, but they're not tackling the underlying mechanisms comprehensively. What I'm going to share with you today is a complete 7-step bedtime protocol that works to address this issue from multiple directions simultaneously. This protocol focuses on helping your body naturally process and move that trapped fluid while you sleep, so when you wake up in the morning, your feet and ankles feel noticeably better. Comfortable enough that putting on your shoes doesn't require a struggle. We're going to work systematically through each step, and I'll explain not just what to do, but why each step matters. Understanding the reasoning helps you commit to following through consistently. Let's begin with the internal foundation, which is step 1. The common advice to simply eat less salt is often incomplete. Severe swelling is frequently related to an imbalance among your body's primary electrolytes: sodium, potassium, and magnesium. Your kidneys manage the vast majority of your body's fluid balance, and they need a specific ratio of these minerals to function optimally. When you're deficient in potassium or magnesium, which many older adults are, your cells tend to hold on to sodium, and when they hold sodium, they also retain water. This contributes to that pressurized pooling you see as swelling in your ankles and lower legs. So we're going to address this with what I call a cellular flush, taken about 60 minutes before your intended bedtime. Here's what you need: magnesium citrate, which is a form of magnesium that's well absorbed and acts as a natural muscle relaxer. It helps ease tension in your blood vessel walls, the very veins we're trying to support. I recommend 1 teaspoon of magnesium citrate powder, which provides approximately 300 to 400 milligrams of elemental magnesium mixed into 12 ounces of water. Now here's the important addition: potassium bitartrate, which you might know as cream of tartar. This is available in the baking aisle of most grocery stores. Potassium works directly to balance sodium in your body, signaling your cells to release excess sodium and the water that comes with it. Add approximately 1/4 teaspoon of cream of tartar to your magnesium drink. Mix it well and drink this mixture slowly over about 10 minutes, exactly 60 minutes before you plan to sleep. The timing here is quite important. By taking this an hour before bed, you give your kidneys and vascular system a head start. It initiates a gentle systemic fluid release while you're still upright, and gravity can assist the process. One important caution: if you have any kidney condition or take medications that affect potassium levels, you must consult with your healthcare provider before using this approach. For most people, this is safe and can be very helpful. But your individual medical situation always takes priority. Your body is now internally prepared, but we need to do more. We need to physically stimulate those veins to improve their tone and function. This brings us to step 2, which involves something called thermal contrast therapy. When blood is allowed to pool in your ankles day after day, the veins can become stretched and lose their natural ability to efficiently push blood back up against gravity. We're going to use temperature changes to trigger a powerful vascular response. This technique is based on what's called the hunting response, which causes your blood vessels to rapidly contract and release, essentially exercising them. You'll need 2 basins or containers large enough for both feet. Fill one with water as warm as you can comfortably tolerate, not scalding, just quite warm. Fill the second basin with the coldest tap water available and add several ice cubes to make it genuinely cold. Here's the protocol. First, place both feet in the warm water for 3 full minutes. This causes what we call vasodilation. Your veins open wider, allowing stagnant blood and fluid to move closer to the surface. After 3 minutes, immediately move your feet to the ice water for 60 seconds. I understand this is uncomfortable, and you'll want to breathe deeply through it. The intense cold triggers powerful vasoconstriction, meaning the veins quickly tighten, forcibly pushing blood and trapped fluid out of the area and back into your central circulation. You'll repeat this cycle 3 complete times: 3 minutes warm, 1 minute cold, 3 minutes warm, 1 minute cold, 3 minutes warm, and finish with a final 1 minute in the cold water. That final cold immersion is particularly beneficial. When you remove your feet afterward, as your skin warms up naturally, it causes a reflexive opening of the veins, creating a flushing effect. This draws fresh, oxygenated blood into your lower legs while carrying waste products and excess fluid away. This contrast bathing is one of the fastest ways to manually help decongest your lower legs before you get into bed. It takes about 15 minutes total, and many people tell me they feel immediate relief. We've now addressed the internal fluid balance and stimulated the veins. But gravity remains a constant challenge, especially as we age. Simply propping your legs on a pillow helps somewhat, but there's a much more effective approach. This is step 3, and it involves actively engaging your calf muscles, which function almost like a second heart for your lower body. The technique is based on a restorative yoga position called legs up the wall. Here's how to do it properly. Lie flat on your back on the floor near a wall. Scoot your hips as close to the wall as you possibly can, then swing your legs straight up so your heels rest against the wall, forming roughly a 90-degree angle with your body. This position immediately places your lower legs above your heart level, which allows gravity to assist in moving fluid back toward your core. But here's the critical refinement that most people miss. You cannot simply rest in this position passively. Every 60 seconds while you're in this position, you need to perform active ankle movements. Point your toes strongly upward toward the ceiling and hold for a count of 5. Then flex your feet powerfully, pulling your toes back toward your head, and hold that for a count of 5. This deliberate muscle contraction actively squeezes the venous reservoir in your calves. The muscle compression physically pushes fluid from the smaller veins in your lower legs up into the larger veins in your thighs and pelvis, where your main circulatory system can process it much more efficiently. Repeat this pointing and flexing cycle 10 times per minute for a total of 5 minutes. Set a timer so you don't have to watch the clock. This combination of elevation plus active muscle pumping creates maximum pressure gradient for moving fluid out of your ankles. 5 minutes of this technique is comparable to receiving a professional lymphatic drainage massage for your entire lower body. Make these 5 minutes absolutely non-negotiable every single night. The benefits are substantial and immediate for most people. Now we move to step 4, which addresses why the fluid leaks out of your blood vessels in the first place. Your smallest blood vessels, the capillaries, can become weak and porous over time due to inflammation and oxidative stress. When the walls of these tiny vessels become leaky, fluid seeps out into the surrounding tissue, which is what creates visible swelling. We need to use a topical treatment that can help tone and support these vessels. This goes well beyond ordinary moisturizer. We're using concentrated botanical oils with specific properties. Cypress essential oil is highly regarded for its ability to support vein health and help reduce blood vessel permeability. you'll need 5 drops of pure cypress essential oil. Rosemary essential oil is an excellent circulation stimulator. It encourages local blood flow, helping to ensure that the fluid we've just worked to move actually gets carried away efficiently. You'll need 5 drops of rosemary essential oil. Mix these 10 drops total with 1 tablespoon of a carrier oil. I recommend fractionated coconut oil or sweet almond oil, both of which absorb well into skin. This application isn't a quick rub. It's a deliberate, targeted massage with a specific technique. Sit comfortably where you can reach your feet easily. Starting at your toes with a small amount of the oil blend, use firm upward strokes to massage the oil deeply into your feet, working methodically toward your ankles, then up your calves. This direction is crucial. Always massage toward your heart, never downward. You're manually assisting the return of blood and fluid through your veins. Spend extra time on the lower portion of your calves and stop your massage just below the back of your knee. Use firm pressure, but if anything causes sharp pain, ease up immediately. This massage serves multiple purposes. It stimulates local circulation, drives the active plant compounds into your tissue, and provides anti-inflammatory support that helps repair weakened vessel walls over time. The massage itself should take about 5 to 7 minutes for both legs. Many people find this part of the routine quite relaxing and look forward to it. We've now drained fluid, stimulated circulation, and supported vessel walls. Step 5 involves maintaining that improvement overnight, and it requires understanding compression correctly. If you've been prescribed compression stockings for daytime use, those are typically rated at 20 to 30 millimeters of mercury, which is appropriate when you're upright and active. However, you should never sleep in high-grade compression stockings. When you lie down to sleep, your blood pressure naturally equalizes throughout your body. Those heavy compression stockings that help during the day can actually restrict blood flow too much at night, creating what's essentially a tourniquet effect while you're horizontal. That's not what we want. What we need is gentle, therapeutic maintenance compression. The ideal solution is low-grade compression socks, typically the kind marketed as light travel socks or flight socks. Look for socks rated between 8 and 15 millimeters of mercury. This pressure level is perfect for maintaining the reduction in swelling we've achieved with the previous steps, without restricting circulation while you're lying flat. These socks provide constant, gentle support that prevents the tissue spaces in your legs from expanding and reabsorbing fluid that your kidneys are still processing overnight. How you wear them matters significantly. For general ankle and lower leg swelling, calf height compression is sufficient. You don't need thigh high unless specifically prescribed by your doctor for a particular condition. Most importantly, check the elastic band at the top of the sock. If this band creates a deep, visible indentation in your skin, it's too tight for nighttime use and could actually impede circulation. The band should be snug but not constricting. If it's too tight, roll it down slightly or choose a different pair with a more relaxed top band. The compression should be graduated, meaning slightly firmer at the ankle and gradually looser as it goes up your leg, not concentrated intensely at the top edge. Put these compression socks on immediately after you finish your oil massage from step 4. This locks in the fluid reduction you've just achieved and maintains it throughout the night. We're now 5 steps into the protocol, and you're almost ready for bed. But before you get comfortable, I need to address something that might surprise you. One of your regular evening habits is likely working against everything we're trying to accomplish. This is step 6, and it involves when and how you hydrate in the evening hours. When you drink water or any fluid, it doesn't instantly pass through your body and leave. Your kidneys must filter it, and this filtering process takes time, typically 2 to 3 hours for your body to fully process a significant amount of liquid. Your body is also considerably less efficient at moving large volumes of fluid when you're lying flat. The kidney function actually slows somewhat during sleep, and gravity no longer assists in moving fluid through your system. If you drink a large glass of water or herbal tea right before bed, that fluid will simply settle via gravity into your lowest extremities while you sleep. You're essentially undoing much of the work we've just done. This is why I recommend what I call a fluid cutoff protocol. You need to stop drinking substantial amounts of liquid approximately 3 hours before your intended bedtime. If you plan to be asleep by 10 o'clock in the evening, your last significant drink of water should be no later than 7 o'clock. After that cutoff time, you should avoid the large glass of water, the cup of herbal tea, or any other beverage. The only exception is taking small sips, just enough to swallow any medications or supplements you need to take before bed, which brings us to step 7. By implementing this 3-hour cutoff, you give your kidneys adequate time to perform their final fluid regulation while you're still mostly upright. This ensures the maximum amount of excess fluid is processed and eliminated before you enter that horizontal sleeping position where gravity works against venous return. I understand this can be challenging if you're accustomed to drinking water throughout the evening. You might need to consciously drink more during the earlier parts of the day to ensure you're still getting adequate total hydration. Just front-load your water intake to the morning and afternoon hours. Now we arrive at step 7, which is the internal repair component that addresses the root cause of chronic swelling. Everything we've done in the previous 6 steps has been about drainage, circulation, and physical support. But the fundamental issue in chronic leg swelling is often what we call chronic venous insufficiency, which means your capillary walls have become leaky and weak. We need a natural supplement approach that can help repair this underlying damage from the inside. There's a 2-part combination that has substantial scientific research supporting its use for venous health and edema reduction. The first component is horse chestnut seed extract, often abbreviated as HCSE. This is a well-studied botanical with a long history of use for venous conditions in European medicine. Horse chestnut seed extract contains a compound called essin, which research has shown can help seal capillary walls and reduce their permeability, that leakiness I mentioned. It also appears to promote the release of certain compounds that improve venous tone, helping your veins maintain their strength and elasticity. You need a high-quality product that's standardized to contain 50 milligrams of essin. The typical therapeutic dose is 300 milligrams of the standardized extract, taken once daily. The second component is Pycnogenol, which is an extract derived from maritime pine bark. This is a remarkably potent antioxidant that helps strengthen the collagen matrix surrounding your blood vessels. Pycnogenol improves microcirculation, meaning blood flow through your smallest vessels, and has powerful anti-inflammatory effects. It works synergistically with horse chestnut seed extract to repair and reinforce your entire vascular structure. The recommended amount is 100 milligrams of Pycnogenol daily. Why take these supplements specifically at night? During your deep sleep cycles, your body shifts into repair and regeneration mode. By taking these vascular supporting compounds right before bed with that last small sip of water, you're providing your system with the raw materials needed for vascular repair during the time when your body is most receptive to healing. This combination helps you transition from simply managing swelling on a nightly basis to actually addressing and potentially resolving the underlying venous insufficiency over time. One important note: horse chestnut seed extract can interact with certain medications, particularly blood thinners. If you take any prescription medications, especially anticoagulants, you absolutely must consult with your healthcare provider before adding these supplements. That completes the 7-step protocol. You now have a comprehensive approach: the magnesium and potassium flush, the contrast water therapy, the elevated leg pumping technique, the cypress and rosemary vessel massage, the appropriate nighttime compression, the 3-hour fluid cutoff, and the horse chestnut and Pycnogenol vascular repair supplements. But before you implement all of this tonight, I need to address one final habit that can instantly reverse all this careful circulatory work. You might be doing it right now without even thinking about it. Crossing your legs. Whether you're sitting on the couch watching television or lying on your side in bed with one leg wrapped over the other, crossing your legs creates a physical compression, almost like a kink in a garden hose, on the major femoral artery and vein that run through your upper thigh. These vessels are responsible for returning all the blood and fluid from your lower legs back up to your heart. When you cross your legs, you immediately create stagnation in the lower leg. All that work we've done to move fluid and improve circulation gets compromised. Tonight, when you settle into bed, make a conscious, deliberate effort to keep your legs parallel and uncrossed. If you're a side sleeper, which many people are, I strongly recommend using a thick body pillow or a regular pillow placed between your knees. This pillow keeps your knees, ankles, and hips properly aligned, ensuring those femoral vessels remain open and clear throughout the night. It also happens to be better for your lower back and hip alignment, which is an additional benefit. This is the final crucial element, maintaining open, unobstructed pathways for your circulation. You've cleaned the system and supported the vessels. Now keep the blood flowing freely. You now have the complete protocol. This isn't based on guesswork or folk remedies. This is based on understanding how your vascular system functions and what it needs to work efficiently. Severe leg swelling is not something you simply have to accept and live with. It can be addressed, and you now have a specific, actionable nightly plan to do exactly that. I encourage you to implement these 7 steps starting tonight. Don't wait. Don't think about starting next week or next month. Your comfort and your long-term circulatory health are too important. You'll very likely notice some improvement even after the first night. Your ankles may look less swollen in the morning. Your feet might slide into your shoes more easily. As you continue this protocol consistently, night after night, the improvements typically become more substantial and sustained. Give this protocol at least 2 full weeks of consistent daily practice before you evaluate its effectiveness. Some people see dramatic results within a few days, while others need a bit more time for the cumulative benefits to become obvious. Be patient with yourself and with the process. Your body wants to heal and function properly. You're simply giving it the systematic support it needs to do so. Now, before we finish, I want to take a moment to address something broader. Chronic leg swelling often doesn't exist in isolation. It's frequently connected to inflammation throughout your body, dietary factors, and overall vascular health. While this nighttime protocol can provide substantial relief and address the immediate concern, lasting improvement often requires looking at the bigger picture of what's contributing to vascular inflammation and weakened vessel walls in the first place. There are common everyday foods that many people consume regularly, thinking they're harmless or even healthy, that can actually promote chronic inflammation and damage vascular elasticity over time. Understanding which foods these are and how they affect your circulation is an important next step in achieving permanent improvement, not just temporary management. I'll be covering that topic in detail in my next video, discussing the specific foods that silently compromise vascular health and what you can replace them with to support healing instead. I hope this video has been genuinely helpful for you. If you found value in this information, I would greatly appreciate it if you would take just a moment to like this video and subscribe to my channel. Your support truly helps me continue creating and sharing this important information with more people who need it. And please, I sincerely encourage you to leave your questions and comments below. Do you struggle with severe leg swelling? Have you tried any of these approaches before? What has or hasn't worked for you? I read every single comment, and I do my very best to respond personally to your questions. Your experiences, your questions, and your feedback help me understand what topics are most important to you, and they help me create even more useful content for all of us going forward. Thank you so much for spending this time with me today. I appreciate your attention and your trust. I'll see you in the next video, and until then, take good care of yourself. Good night.